For me, chiropractic care was something that I was very familiar with. When I've been going to chiropractors for about 20 years at least, and the big thing was chiropractic had started to seem a little bit like massage therapy. You'd go, you'd feel a little better for a while, and then 2 weeks later you'd have to go back. And it was kind of a never-ending process. Again, having incurred an injury when I was young, it was a sports injury when I was in high school. And my parents were doing chiropractic with their chiropractor at the time. And so naturally I just went with him and just assumed that was, the best thing to do. But as time went on, it never really improved. They would do things like, well, you need a lift in your shoe because, one leg is slightly shorter than the other, and that's going to balance you out. And it never really got to the point where I could walk long distances or run without pain. And over the years, it just never really got any better. It was like they were treating the symptoms. They're not really solving the problem. By the time that I heard of Dr. Benjamin, from one of my wife's friends who's a massage therapist, she said, this guy's different. He does things, differently than the typical chiropractor. And again, I was skeptical because at this point in my life, and I'm sure a lot of people are like this, I don't have the financial resources to put towards something that's not measurable, that I don't see a result from. And for us, with two small kids, you typically don't want to spend money on yourself. Now this, at first, I had to get over that because, you've got things you want to do with your kids. There's dance lessons. There's sports, stuff you want to do for them. But at the end of the day, this gives me the ability to interact with them a lot more than I would if I'm laid out with back pain for any length of time. So ultimately, that is, at least for me, the biggest impetus for continuing training and actually making this a priority. For me, I needed to, in advance, know that there's an end point to this, and there's goals. There's benchmarks throughout the treatment process that I can look at and say, yeah, I'm improving. And it's not just something that I can feel. The X-rays that you get through the treatment process, you can really see the changes that are happening in your body. And that, to me, is the value, because it's not something that's subjective. It's not something that's just, well, I feel a little better. I can see that the process is actually making major changes. And along with that, I've been able to, you get results that you're not expecting. I breathe deeper now, so I sleep better at night, which, I never had any idea that something like that could happen. It's been a life-changing experience for not only me, but my family, because over the years, you just kind of get to the point where you become comfortable, well, not necessarily comfortable, but familiar with the pain. And you have this diminished physicality that you're living with, and you just kind of accept it because it becomes the norm. And that was the point I was at when I came to Dr. Benjamin, and he said, you don't have to live like that. You don't have to be that person. And just to have that as hope, to improve physically is huge, huge. I have two small kids, and I want to be able to run with them. I want to be able to do things with them. And that's very important to me. And to be able to get that back, just even the notion of it, to be able to get that notion back is, there's no amount of money, that can be, better than that. I mean, it's fantastic.